Detailed planning goes into a woman's pregnancy and her new baby's arrival, but the postpartum recovery is often overlooked.
It's true. This morning we're talking about a largely unrecognized condition many women suffer from after pregnancy without it ever being diagnosed. Being active and staying fit isn't a new concept for 33-year-old Sarah Tarr.
I've been an athlete since I was a child, playing every sport that I could find myself getting into from a very young age.
She's a full-time working mother of 3 daughters, but she's always made time for fitness, no matter what.
I was active each pregnancy, working out before, during, and after each child.
Her doctor at the time said that was no problem.
The guidance was given just to listen to your body. So I continued doing every movement that I would have done if I was not pregnant.
But after her second pregnancy, things weren't quite right with her postpartum recovery.
And I was having a really tough time performing lifts and performing the movements that I was used to being able to doing while I was pregnant. In addition to that, I experienced a lot of pelvic pain, incontinence, and back pain. I knew that something else was going on. I just wasn't okay with sitting back and saying, well, you've had a baby, this is what's going to happen.
Through her own research, she discovered she had a condition called Diastasis recti, a separation of the abdominal walls that result in a protruding belly. A normal symptom during pregnancy, but not afterwards.
I could fit 4 of my fingers into my abdomen and almost go knuckle deep into my belly button. So there was a wide gaping hole where it still looked like I was significantly pregnant several months after giving birth.
Sarah wishes she had known more about the postpartum journey, and she wants other women to know they're not alone.
You should never have to go through life having issues like pelvic pain, incontinence, having this issue that takes away from the fitness that you enjoy or doing things that you love. There is help out there, and you just have to ask those questions.
And Sarah Tarr joins us now. Sarah, thank you for coming in and really talking about this. A lot of women, they feel that pooch, but they don't know what it is. Full disclosure, I had it as well after my twins, so I know exactly what you have been going through. But when did you know that something wasn't right?
Shortly after my 6-week checkup, and I was going back to the gym, getting back into my fitness routine, and things just were not feeling 100%. You know, my stomach looked like I was still pregnant, and a lot of the movements I was performing at our gym were very uncomfortable to me, along with having, you know, back pain and pelvic pain, and just body didn't feel good. So
it's not just a visual thing. I mean, this needs to be corrected using certain exercises, because yours was really severe. I mean, 4 fingers. How severe is that?
Well, in my situation, it's not the most severe case that's out there, but it can be a problem.
Mine was a hand.
You can fit your whole hand in
Put the full hand all the way down. Yeah.
Wow.
And, you know, each woman is different. So exercises that may work for me, I might not prescribe to somebody else that comes to our facility. So each woman needs to have an assessment by their pelvic floor physical therapist and work with their practitioners to get the right support and the right diagnosis.
So were you able to, I mean, you look fine to the rest of us. Were you able to correct the issue, or how did
through rehab and
really?
Through working with my pelvic floor PT, I was able to find a process that really helped me recovery. And then with my 3rd pregnancy, follow through on this last pregnancy doing the same routine. And today I have less than 2-finger diastasis.
Wow. Can you give her a round of applause?
Yeah, that takes a lot of work.
I'm like, can I give you credit? Because I think people don't understand. Your abdomen, it like parts like the Red Sea.
Yes.
And it just does not come back together, right? So all your insides are just, and it's just why you have that pooch. There are DVDs, there are YouTube videos, and you do them and nothing works. So the fact that you were able to get it to work on your own with exercises is huge. So I wanted to give some advice this morning to anyone listening. Sarah, she researched the condition with the help of Jill Miller. She's the author of The Role Model. Jill, thank you for coming in. What would you say to add to this discussion? And then we'll get some medical advice as well.
Well, what happens with the diastasis is that there's a thinning of really the fascial zipper of all of the different abdominal layers. But the deep, deep abdominal layers really are a part of your breath mechanics, your respiratory system. So the training, the rehabilitation really begins with being able to sense those respiratory muscles and how they contribute to tension across the midline and being able to maintain tension, correct tension in the process of exercise and your everyday activities.
And to get a doctor's take on this whole thing, Dr. Tara Shirazian is here. And this is something, if you have it, do you have to get it diagnosed? Do you have to get it fixed? I mean, how bad is it if you don't get it corrected?
Well,
first off, I think it's really important that women understand their bodies. And so I think women's health education and empowerment is the key to everything. So it's really important to understand what your body goes through when you're pregnant and then postpartum. I think it's also important to understand that many things can cause diastasis recti, including large abdominal masses, obesity. You know, we have lots of underlying causes. So it's important to know what it is. It's important to try and fix it through conservative measures like exercise and like doing all these lifestyle changes that you did, which are amazing. And then if those things don't work, we also have other therapies like surgical correction if needed. So women should feel good about themselves. They should understand their bodies in pregnancy and postpartum, and they should do the things that make them feel good and empowered.
Well, thank you guys for talking with us. Thank you for coming in and
Thank you.
sharing your story. There are a lot of women right now who are saying, wait, maybe me too.
Yeah.
And so you may help someone you don't even know watching this.
Yes.
Hopefully you help a lot
Get
of
to your
people.
practitioner and ask for the help.
Yes. In fact, if you want more information, because I'm sure many of you probably want to know more, we put everything on Facebook. So just go to facebook.com/todayhealth. We'll be right back.